Welcome to Loma University Health. This is the very place where residents enter to learn and leave to serve. Our faculty enter to teach and heal, stay to thrive through lifelong learning and service. We hold true to our motto to make man whole without losing sight of our mission, which is to continue the teaching and healing ministry of Jesus Christ. Our department of 10 divisions and over 190 physicians are here to support you and help you achieve your career goals. We look forward to you being part of our Department of Medicine family.
115 years ago, idealistic young faculty from the American Medical Missionary College came to Loma Linda to do something new. They started a medical school and they called it the College of Medical Evangelists. The legacy of those idealists inspired generations of learners. For the next 60 years, nearly 20% of Loma Linda faculty did international medical service, starting clinics across the globe. They understood the connections between spirituality and health and the real meaning of the mission to make man whole.
Welcome to the Internal Medicine Residency Program at Loma Linda University. I'm so happy you've decided to apply to our residency program. I am confident you will find our program has everything you need for a well-balanced residency in internal medicine. One of the things that makes our training program so outstanding are the 3 clinical sites you will rotate through. Our residents spend time at Loma Linda University Medical Center, the Jerry L. Pettis Veterans Administration Medical Center, and Riverside University Health Systems Medical Center. In addition, our residents rotate through outpatient rotations at our Social Action Community Health System, or SACS Clinic, which is a clinic designed to serve the population of San Bernardino County. These sites also serve as choices for your continuity clinics, where you will spend time over your 3 years here following your own panel of primary care patients.
Loma Linda University Medical Center is a state-of-the-art facility. We provide tertiary care and have very specialized care, which includes interventional pulmonology, interventional GI, interventional cardiology, just to name a few. We are a level 1 trauma center, and we have 320 adult patient beds. Our residents here have the opportunity to see a wide variety of patient cases as we serve over 25% of California's population. Some of the things I truly enjoyed about being a resident here myself are geographic grounding and being part of the multidisciplinary team. Our multidisciplinary team includes physical therapy, case management, social work, and pharmacy. Our residents here have the opportunity to choose from a variety of electives. These electives include working one-on-one with our chief residents on our robust procedure team, and others include working directly with a hospitalist, especially for those who are interested in pursuing a career in hospitalist medicine.
Rotating through the Veterans Hospital is a very important part of our curriculum because it allows our residents to be exposed to the conditions that are most common in an internal medicine practice. The Loma Linda VA Hospital has 560 beds. In those 560 beds, we have several general medicine wards, surgical wards, medical intensive care unit, cardiac care unit, surgical intensive care, and the community living center, which is our area of subacute care for our veterans who are receiving long-term antibiotics. And also we have areas for veterans receiving hospice care. When many people think about the Veterans Hospital, however, they think about treating only men. Today, our military is much more diverse, and therefore we have incorporated a women's clinic into our outpatient clinics.
The VA Ambulatory Care Center is a large, modern facility where we're very excited to get to have clinic. About a third of our resident physicians have their continuity clinic at this site. We have over 270,000 square feet. It's a very modern facility, plenty of exam rooms for every one of our resident physicians. And one of the advantages is we actually have a number of other support services and subspecialists that work within this same facility as well. We have psychiatry, psychology. We can see patients the same day if necessary. We have nutritionists that are happy to work with our patients as well as of course, some of the other services that you would expect of any modern medical facility. We also have things like same-day imaging on-site, same-day lab draws, so a big benefit for our patients as well. Speaking of the patients, of course, being the VA, we have a classic contingent of veteran patients. Some of these go all the way back to more distant conflicts like the Korean War or still the occasional World War II veteran, as well as more recent conflicts such as Iraq and Afghanistan. We deal a lot with kind of classic bread and butter internal medicine cases, everything from diabetes, hypertension, heart failure, to some things that are more unique to our veteran population, things like traumatic brain injuries or post-traumatic stress disorder.
As one of the 3 training sites for Loma Linda Internal Medicine Residency Program, we offer various rotations at Riverside University Medical Center. Our hospital was established in 1893, originally located in downtown Riverside. Since then, it was relocated to the city of Marana Valley in 1998. Our hospital is a 439-bed Level 2 trauma center with 10 federally qualified healthcare centers located throughout the county. For more than 100 years, the hospital has been functioning as a regional safety net hospital and provided foundation of healthcare, community wellness, and medical educations for those who are underserved and often socioeconomically disadvantaged. During your internship year, you'll join our inpatient internal medicine team. You'll have opportunity to closely work with teaching attending staffs who are passionate about training the next generation of physicians. Other educational opportunities at our hospital include ambulatory and procedural rotations. During the procedure rotation, you'll have an opportunity to perform over 60 procedures. By end of the rotation, you'll be proficient in performing various of different procedures, including paracentesis, central line, bone marrow biopsy, and many others. We are committed to providing a safe learning environment for the residents by creating an atmosphere that strikes a perfect balance between supervision and autonomy. We truly believe that the learning occurs when we strive to provide the best care for our patients. In addition to our currently existing hospital, we added a brand new ambulatory center and outpatient surgical center. As a resident of our program, you'll have the opportunity to work in this brand new building to provide the best care for our patients.
One of the things that I love about being here at the Loma Linda University Internal Medicine Residency Program is the opportunity it gives me to work with the Hispanic population here in California.
Lots of our patients here in our residency program prefer when you speak Spanish to them, or it's their primary language. We have 3 centers that we work at. 2 of them, Loma Linda University Medical Center and RUHS, they have a big population of patients that prefer to speak Spanish with their physician or with their provider.
In the clinic, I'm able to explain to them what's going on, why are they taking these medications, and you could see their satisfaction, and that brings me a lot of joy. You can also see how they get better with time because now they understand what's going on. They understand why they're taking this medication.
Here, you will have the opportunity or the privilege and honor to serve that population. Personally, I have had the experience where I've been able to connect with them because I share their cultural experiences, because I understand their background, and because I can talk to them in their language, and also I can relate to what their families are going through, and you can explain things to them in a very basic manner, which they really appreciate.
Every time I come to work, it brings me joy to know that I'm making a positive impact on this population.
We also have special pathways and tracks within our categorical residency program designed to tailor your training to your special interests. Our 2 tracks are the primary care track as well as the global service track, which you can apply to through ERIS. Once you match here and arrive on campus, we have 4 pathways available to you: the HIV pathway, a lifestyle medicine pathway, a research scholars pathway, as well as a point of care ultrasound pathway. Here are some of our lead faculty members to tell us more about each of these options.
As part of the Loma Linda University Internal Medicine Residency Program, you have the ability to be part of a select group of residents in the HIV pathway program. The HIV pathway is a unique learning opportunity where residents become comfortable and confident caring for persons living with HIV in the outpatient setting. Participants in the pathway will build up a core panel of patients at the J.L. Pettis Veterans Administration Healthcare System in Loma Linda. Under the mentorship of HIV ID specialists, you will gain valuable clinical skills managing not only HIV, but also primary care issues affecting patients living with HIV. To augment and further learning, each month there will be a dedicated small group didactic session provided by a wide variety of faculty and practitioners. Being in the pathway, you will have exclusive opportunities to engage in research and quality improvement projects under the sponsorship of ID faculty. At the end of the pathway, you will be eligible to earn an American Academy of HIV Medicine certification, signifying your expertise in HIV. Each participant in the program is afforded different avenues to learn how to be effective educators, such as teaching their peers via HIV journal clubs, small group sessions, noon conferences, grand rounds, and other scholarly activities. But being part of the HIV pathway means so much more.
Hi, it's my pleasure to talk to you today about the Lifestyle Medicine Pathway. It's a really exciting opportunity for you to change your own life as well as the lives of your patients. It consists of 5 main things. The first one is a didactic component that we call the Lifestyle Medicine Residency Curriculum. This is a 40-hour made by residents for residents curriculum that has been implemented in over 40 programs nationwide. It's designed to be part of your primary care residency program. The second component is application activities. This is your chance to apply what you know about lifestyle medicine to your own life. For example, cooking yourself a whole food plant-based meal will count towards a total of 60 hours of application activities. The third component is having patient encounters. So we want you to keep track of 400 patient encounters in which you talk to your patients about things like exercise, sleep, nutrition, and toxic substances. The fourth component is mentorship. So you'll meet someone from the preventive medicine faculty semi-annually to check your progress and make sure you're on track to graduate on time. The fifth component is an elective month with preventive medicine, so you can focus on seeing those lifestyle medicine patients and getting your patient encounters. Why is lifestyle medicine so exciting? Well, it can really reverse disease. Things like diabetes type 2 can be put in remission, and heart disease can be reversed. Who learned about that in medical school? They don't teach these things. That's why we're here to let you know that it's possible and give your patients options when they feel like they're destined to be what their genetics make of them. We have new and exciting science that shows us that your genetics are not your destiny. Your lifestyle behaviors count way more. And in fact, there's something called epigenetics that can really make the difference between life and death. Please join us with this exciting pathway to learn more about lifestyle medicine.
We offer a point-of-care ultrasound pathway where our goal is to train you to be a point-of-care ultrasound expert, integrating ultrasound into your daily practice, as well as training in point-of-care ultrasound education and research. Some key features of our pathway include additional ultrasound and procedural electives, constant access to a handheld ultrasound device, and cart-based ultrasounds in every facility. Our goal is to tailor the training to meet your professional goals.
Well, it's a pleasure today to talk to you about the Research Scholars Pathway. And this program is pretty unique in that it allows residents to have protected time for clinical research. Residency can be really, really busy, and so sometimes it's hard to get that protected time, particularly for people who are interested in clinical research and want to kind of go down an academic pathway. So I was very excited that the internal medicine program actually offers that to residents. So to that end, in their second and third year, residents are able to have up to 6 to 8 weeks of protected time for clinical research. They also will find a mentor of their choosing, and there are many investigators here at Loma Linda who are active in clinical research that they would be trained under, mentored under, and then the Pathway program also has an actual curriculum. This curriculum is pretty extensive. It's about a 1.5-day seminar, and it really goes through all the nuts and bolts of how to run research, and also, if you're interested, set up a research career. The goal of this Research Scholars Program is really to assist with exposure, training, and also get experience. And with that experience, we also want the residents in this program to be able to get demonstrable evidence that they were doing research. So We encourage applications to posters and presentations. In fact, Loma Linda has its own annual conference that it does that allows people to be first author on posters and presentations. That's something that I think is a unique opportunity, but also we would want you to publish in different journals and we would give you the tools. So it's this unique clinical exposure, a scholastic achievement, and then really a dedication and priority to help you also, if you're interested, get into some of the most competitive fellowship programs. So as you know, in some of the more competitive programs at academic universities, they're very research focused. And many are looking for applicants who have research experience or who are interested in academic career. So in this program, we also will be helping people with their CVs to integrate their experience, to integrate their scholastic achievement, to give them the best chance to further academic professional career or to further their career in some of the top U.S. fellowship programs. So really exciting pathway. Thrilled that I'm able to share it with you all.
The primary care track is a subset of our internal medicine residency. This track offers residents an opportunity to rotate through more outpatient experiences throughout their training. As part of the track, residents will design, along with the faculty, an individualized month each year that focuses in on a particular area of interest. This could be additional time with general outpatient medicine, subspecialty rotations, or outpatient procedural skills. With our track, residents will do additional academic half-days led by our subspecialty faculty that focus in on particular topics in outpatient primary care. This track is a great option for residents who are interested in outpatient general medicine, inpatient-outpatient hybrid medicine, or simply want to see more of primary care during their residency training.
Another major focus of our residency program is resident well-being. Loma Linda prides itself on focusing on whole patient care, but for our program, it goes even further. We value wholeness for our residents as well. We have many resources dedicated to your well-being and fully realize that having whole, healthy physicians makes for excellent patient care and an excellent experience while you're here. We have our Department of Physician Vitality. Director Barbara Hernandez and her team are available to you 24/7 for wellness checks, short-term therapy, or just treating you to coffee and a meal after a long day at work. In addition, we have free longer-term therapy options for you and your immediate family. We have a concierge primary care program that prioritizes resident primary care appointments. You and your immediate family members can call our resident appointment line and be prioritized for medical appointments that work with your schedule. We also have this option available for mental health appointments. In addition, our program has chief wellness residents who serve on institutional committees and focus on the well-being of our residents in our program.
Loma Linda VA cardiologist Tiffany Priester graduated from the School of Medicine in 2004. She went from Loma Linda to Mayo Clinic, where she did an internal medicine residency, and then to Salt Lake City, University of Utah, for a cardiology fellowship. From there, she went to serve in Malawi as the only cardiologist in the entire country. During a maternity leave, I had the opportunity to talk with Dr. Priester. "What have you done," I asked her, "that you think will make a difference in Malawi?" She reached into her purse and handed me a spiral-bound booklet. I started leafing through it, and I said, "Tiffany, are these recipes?" "Yes," she said. I said, "Well, who made them?" "I did." As I flipped through the book, I said, "What's this ingredient?" She said, "That's a beetle." I flipped a few more pages. "What's this?" "That's a special kind of ant." I said, "Wait a minute, Tiffany, stop. You are a member of a faith community that's known for healthful living and vegetarianism. You basically are serving in Malawi and you're teaching people to eat bugs?" Tiffany explained to me, children are weaned at about 20 months of age in Malawi, and that's when they develop protein deficiency syndromes and kwashiorkor in extreme situations. I didn't like what I was seeing, she said, so I decided I would do something about it. I went on a search for protein, and I couldn't find conventional sources, so I began studying insects, and I found the protein was good protein, and in Malawi, there's an abundant supply of insects. So I began to develop recipes. She said, this book is the recipes. Every one of them tastes good. I've eaten them all, and I think this is the contribution I'm making that will make a difference. Tiffany's story illustrates the adaptability and smarts of doctors who want to meet the needs of their community. Residents who choose to serve overseas and those who stay in our diverse region will be prepared for the surprises of their own careers to make a difference in their communities. Residents don't choose their program based on the perks. They choose it so that they can learn expertise and skills connected to their future practice. Loma Linda and Southern California provide endless opportunities to reboot and recharge. Mountain bike riders, street bike riders, snow skiers, beachgoers, theme park aficionados, they will all find great opportunities to recharge, reboot, and do good things in the region.
Thank you again for your interest in our residency program. We look forward to meeting you and hope that you will join us for your training in internal medicine.